For those wishing to use broad-spectrum micronutrients, we'll now turn our attention to some considerations for their use in clinical practice. In the ADHD RCTs, researchers searched for predictors of response. They found that in the majority of individuals, baseline nutrient levels like B12, zinc, folate, iron, potassium from blood were within normal range, and nutrient levels did not predict who would respond to treatment. In other words, someone with a normal level of nutrients was just as likely to respond clinically as someone with a low or abnormal level. It's hypothesized that this is the case as an individual's nutrient needs may be higher than the population average, so blood levels of nutrients will not define who is deficient relative to their own metabolic requirement. Now let's discuss how to address potential side effects. It's helpful to instruct patients that if they're having difficulty getting to sleep, it's best to take the final dose before 5 or 6 p.m., as the B vitamins in the formula can be energizing for some individuals. Although GI symptoms occurred equally between the placebo group and broad-spectrum micronutrient group in the studies, about 25% of participants did report GI symptoms, of which 5% reported nausea. Clinically, patients have reported nausea and symptoms improve by taking broad-spectrum micronutrients with food, preferably sandwiched in the middle of a meal. It's important to drink 6 to 8 glasses of water daily for adequate hydration in adults. For a child, the amount of fluid ounces needed per day is approximately weight in pounds divided by 2. All capsules cannot be taken at the same time, as there's a limit to the amount of nutrients that can be absorbed at a given time by the body. It is recommended to maintain a minimum 2-hour separation between doses. In other words, the doses do not have to be equally divided throughout the day. The Empower Plus Advanced formula is recommended to be given in 2 separate doses, and the Daily Essential Nutrients formula is recommended as a 3 times daily dosage. A common hurdle for children to take micronutrients is difficulty swallowing, especially since the capsules are not small. To give you a context for size, they are not as large as a typical omega-3 capsule, but larger than the typical small prescription tablet, and many children do find them large. In my experience, most children over age 7 can be taught how to swallow pills. If they're struggling with swallowing, it's often helpful to first identify that anxiety is likely the driving force, as the child may fear that they'll choke. This slide contains a link for a video which teaches children how to swallow pills with a small candy. It is https://bonniejkaplan.com/how-to-swallow-pills. This protocol was tested in 348 people across several studies and then validated in a clinical sample. Children are taught 5 head positions for swallowing. This is followed by 2 weeks of practice. DEN and E-Empower Plus are also available in powder form and can be mixed into smoothies and various types of cookies. Capsules can be opened and used for recipes, but may have more of a bitter taste compared to the powder. Vitamins are destroyed by heat, hence why the recipes are no-bake. If opening the capsules and putting them in applesauce or yogurt, they may have more of a bitter taste compared to the powder. Key points. No key consistent predictors of response have been identified for broad-spectrum micronutrients in clinical trials. To minimize side effects, broad-spectrum micronutrients should be taken with a meal, ideally spaced 2 hours between doses. Recipes are available for patients who are unable to swallow.